Hey y'all, welcome back. This is going to be the last hormone video in the menopause playlist, at least for now. We're going to be talking about the uses and indications for testosterone replacement in perimenopause and menopause or postmenopause, depending on how you use the term, colloquially. What the indications are is recognized by the FDA, the limited but options for routes of administration, and more. Subsequent videos, I might talk a little more on the other prescriptions that are non-hormonal, things like that. So this is going to be a little shorter video, but I hope to give you some nuanced things to look forward to regarding research that we might have coming out and more. So I hope you find it is helpful, though it is going to be a little more condensed than my prior videos if I don't ramble too much. Anyway, let's get started. Testosterone, we all know, is a hormone. Men have it, women have it. We just have it in a lesser degree. And it can be really helpful for a lot of things. So when we think of executive or cognitive functioning, attention, energy, but as far as the current state is in the United States, the US FDA really mostly approves it for indications such as low libido or hypoactive sexual desire disorder in premenopause, menopause, either way. And that's kind of where we are, even though there's other data emerging that show benefits for energy, maybe bone health, things like that. I think we're going to get more data in years to come, but that's just as of right now. This is August 2026 where we are. So that is something where if you are having a plethora of stereotypical perimenopause symptoms, memory or attention, cognitive, fatigue, low libido, or that kind of spectrum where it's not just that, but arousal, orgasm, things like that. And that is something that we can consider this for. It is typically a gel when I'm prescribing it, and I'll get into the nuances of use. It's a little complicated right now in a way, simple and complicated at the same time, of how you can use it. But a lot of women will find over time, which could be some weeks, so give it at least 6 weeks to see, but ideally closer to 3 months if you're going to get a benefit. So the gel is an FDA approved formulation, but whenever I'm writing it, and this is how I find that pharmacies around me can do it, have it in supply, is it's actually a men's dosed prescription. It's a box, and it's got 150 grams of testosterone gel in it, 1% gel. It's broken into 5-gram packets. There's 30 of them. And the reason that I tell patients that it is that way is because that's designed to be a 30-day supply for a man. So for women in peri and postmenopause, we will not be using that much of a packet. We'll be using about 1/10 of a packet. So when you crunch the numbers of the concentration of the gel, that should be around 5. So anyways, I'll have women write it to the prescription or write it to the pharmacy. There are just over time where I am locally certain pharmacies that I can about guarantee have it, can about guarantee will not have it, and the estimated prices. And I can get into pricing later, though I probably wouldn't pin your hat on it because pricing can change and fluctuate depending where you are and supply and demand and all that stuff. So what I'll have women do is apply it. And this is just how I was trained when I was doing CME training, like with Rachel Rubin, who's a urologist and sexual medicine expert. She would say to put it on the calf. And the reason is not necessarily that that's the best or only area. It's just if women were to get a little more coarse, thick, dark hair growth in that area that they're putting it, they're more likely to shave the lower part of their legs, just because stereotypically women do that. Obviously, you don't have to. It's up to you. But you can put it farther up on the leg or anywhere kind of where there's some subcutaneous tissue. What I'll tell people to do, and women tend to be a little more relaxed or like type A about the dosing, is put like a pea to lima bean size amount. And I've had a patient be like, well, I don't know what size beans are. Once a day to that area in the morning, let it dry. Don't touch pets or kids or anything to that area. So if you do have pets or kids that are down there, maybe you want to put it a little higher up. Go wash hands while it dries and go about your day. I've had some women be fine with that, and we just say use 1/10 of the packet and they are good. And maybe it's just one day they get a little more, one day they get a little less, but in the grand scheme of things, they're feeling better. I've also had some women where they say, well, is it okay if I get a syringe and put this gel into the syringe and just measure out like a fairly finite amount that is measurable? And I would say absolutely, if you do not mind using a syringe and cleaning it up, or maybe putting all of the packet into one syringe and just reusing it multiple times, because it doesn't have to be sterile. It's not like you're injecting it. I've had women who prefer to be a little more exact like that, and that's okay. To each their own in that regard. And anyways, that's kind of how I explain to use it. It's very simple. It can be a little logistically harder to get, and that is regardless of insurance status, just how we are in the US. There's currently, I think in Australia, I think it's called Androfem, a women's dosed testosterone pump. We don't have that. We do have Androgel, brand name here for men. It's a 1.62% pump concentration, so it's just a little strong for a women's unless they're only going to use part of the pump. And then just where we are landscape politically, whatever right now with this medicine is considered controlled. So the pharmacists I've talked to, they say they cannot break that larger box apart. Just if a woman wants to try it and see if it helps before she buys the whole box, they say, well, we can't do that because it's controlled. So that makes sense. It's just something, if you run into that in the pharmacy, at least you know why. Not that it might make you feel any better. But the other caveat with that is because they can't break the box apart, you do have to buy the whole box at once. So the upfront cost is a little bit more. Here it tends to be 90 something to $100, which can seem like a lot, but if you think about how long it lasts, because that's a 150 gram box, it's going to last most women like 9 to 10 months. So if you break it apart, price per dose or unit ends up being pretty affordable. And for the most part, for most of my patients, they feel better doing that dose. There is one patient, we checked a lab just to see where she was and ended up increasing her dose just a little bit. And it's because some women just may absorb it better than others. As far as the gel goes, you think about the bioavailability being maybe like 10% compared to injections, and that's just something that I don't really do a lot, is the testosterone injections for females or for women in this day and age of menopause care. It definitely theoretically could be an option. I just think the hardest part would be finding a volume and syringe and amount that is low enough where you're not giving them too much, because you don't want those negative side effects, especially because some of them, like clitoromegaly or voice deepening, can be permanent if you are overdoing it. So that is another potential option if you can't get a gel or a cream that works well for you, or that you feel like is effective when talking with your doctor about these things. But it doesn't usually come up to be a problem, I will say, just from my experience. But anywho, speaking of side effects, I just mentioned a couple. You could also think, acne or just other things that are more testosterone, puberty kind of stuff. So if you are having a higher level, definitely want to get that checked. They're going to, just depending on the units that lab is using, probably want you at least, maybe 30 to 50, kind of just depends. But the big picture is just, are you symptomatically feeling better, and are you not too high? And we'll be looking at those kind of, the lab may have it referenced for different doses based on male or female. So that's just something to keep in mind when the labs are being interpreted, if you are getting labs done. It's not 100% necessary, just kind of depends what the question is or the goal, getting that lab. I typically am not going to be the one, and I know everyone's going to have an opinion on this, just depending who they talk to or where they trained. But as far as the compounded, like creams or troches, lozenges, things like that, I'm not going to be using those personally. Pellets, not a huge fan of those. I know I have one patient who really liked it, and she moved here from another state, and she's found someone that will do that for her, because I don't do pellets for a few reasons. But I've had some where they were like, those were too strong, I didn't like side effects. They've had unwanted, potentially permanent side effects from it, from the testosterone being too high. But anywho, so it's just not something I personally do. If you are having a pro-con discussion with your doctor and they do offer it, I'm sure they have several options and doses and things like that, but that will be a conversation you'll have. So those are some things you may hear about regarding perimenopause and menopause use of testosterone. I hope this was helpful, things to look for, things to not look for. But anyway, I hope that you will join again next time. We're going to be moving on to more non-hormonal medications, and I'll start to venture back into other videos and topics of medicine and otherwise get out of this menopause theme that I've had the last month or so. And if you have any questions or further idea recommendations, feel free to drop them in the comments below. I'd love to do some ideas that y'all think are helpful, and we'll see you next time.